Hi, my name is Fahad bin Waqas from the Department of Medical Laboratory Technology, Radford University College, which is based in Accra, Ghana. And I'm presenting on the topic Assessing the Knowledge, Practices and Attitude of Pharmacists, Prescribers, and the Community toward Antimicrobial Resistance in Ghana. The presentation will go by the following outline. There is going to be a background, aims, methods, and this follows on till the references. At the point of the results, however, since the study examined 3 individual groups, each of the groups will be tackled individually, and the descriptive statistics as well as inferential relations between certain demographic features and attitudes and knowledge would be assessed. In general, antimicrobials have been one of the most successful forms of chemotherapy in the history of modern medicine. We say this because they have gone a long way to reduce both morbidity and mortality that was attributable to infectious disease since their introduction in the 1940s. Unfortunately, alongside the major strides that have been made with drug discovery in terms of antibiotics, there has also been a quite rapid development of antimicrobial resistance among microbes, and this has and continues to pose a universal threat to humans, animals, and the environment at large. For example, the current COVID-19 pandemic is quite disconcerting from an AMR standpoint because a lot of individuals are being given drugs like azithromycin, for example, which is being used in this situation to abate any secondary bacterial infections. It's not being wrongly prescribed at all, but then there are going to be some long-term repercussions that we may have to withstand. So the question which arises is, what exactly is AMR? In the most basic sense, antimicrobial resistance is the ability of an organism to adapt or mutate in such a way that an antibiotic or an antimicrobial that was initially effective against it is no longer as efficacious or effective at all against it. Over here we see a population of dividing bacteria, among which one has had or has undergone a mutation in its DNA, and this DNA mutation has conferred a resistance onto the organism. So what now happens is when an antibiotic is introduced, all the susceptible bacteria or sensitive bacteria are killed, and what remains is the resistant strain, and this can go on and fester and cause and wreak great havoc. The means by which bacteria are able to cause this resistance is by adopting several mechanisms, some of which have been outlined in the picture you see to your right. Most commonly, they pump the antibiotics out via an efflux pump. In other cases, they modify the antibiotic target such that the antibiotic no longer has a binding site. In some instances, they produce an enzyme that actually inactivates the antibiotic. And all these mechanisms are usually seen in individuals or as a result of individuals consuming subtherapeutic levels of antibiotics, where the microbe gets a sense of the therapeutic agent and is able to rapidly mutate and adapt to coexisting with it. Over the last several decades, bacteria have consistently acquired resistance to new antibiotics, and this is a very alarming feature. The depiction you see below shows the various antibiotics, some of the various antibiotics that have been deployed, and the time span within which resistance was observed for them, you would notice that in most cases the time between the two is relatively short, which is quite an interesting thing to observe, how quickly these bacteria are able to adapt. According to the WHO, by the year 2050, 10 million people would die every year as a result of resistant infections. Upon closer examination of the infographic you see below, you would realize that the two largest continents on the face of our planet, Asia and Africa, are going to pay the most heavy. Asia is projected to have cases more than Africa. However, these are projections, frightening projections, but with current research, we might be able to abate some of these figures. Within the Ghanaian context, AMR is fast emerging as an issue of public health concern. This is because there has been a marked increase in the isolation of resistant organisms from patient specimens across the country. Numerous studies have also shown that there is resistance in microbes to very commonly prescribed antibiotics such as ampicillin, chloramphenicol, clotrimazole, and tetracycline. There is no real national surveillance system at the moment which is interconnected. There are surveillance systems in the country for antimicrobial resistance. However, there seems to be a lack of connectivity between them. And so it's safe to assume that the selection of antibiotics for the treatment of a lot of infectious diseases is not often informed by any surveillance data. So that means that within our context at least, AMR, well, not necessarily our context, in the global context actually, AMR is an issue that just does not involve one group of individuals, it involves everybody. So this includes the clinicians, the pharmacists, and the patients. Therefore, the aim of this study was to actually assess the attitudes, the knowledge, and the practices of these three groups and how well this fared with regards to antibiotics and antimicrobial resistance. The study relied on a cross-sectional design, and 3 individual questionnaires were administered to each each group of individuals. So physicians had a unique questionnaire, so did pharmacists and the general public. This was done between the months of June and July of 2020. The internal consistency of all the questions was analyzed with Cronpax alpha, and key associations between demographic information and responses were analyzed via chi-square test of association, Fisher's exact test, and independent t-test. As far as the results went, 51 clinicians responded, 56% of which were male and 43% of which were female. A vast majority were between the ages of 21 and 40, and about 80% had 1 to 5 years of working experience. 63 pharmacists responded, of which majority were male. A vast majority were between 21 and 40, and about 80% had a bachelor's degree in pharmacy. 60% had 1 to 4 years of working experience. As far as the general public went, 652 individuals partook in the survey from 14 of the 16 regions of Ghana. Majority of the responses were had from the Greater Accra and Upper West regions respectively. About 64% of the responses, in fact exactly 64% of the responses were had from males and 36% from females. A vast majority of the responses were had from individuals that were settled in urban areas, and about 90% of all responses were had from individuals who were university educated. Among the clinicians, 82% stated that patients demand for antibiotics. About 75% said AMR was a problem they faced in their daily practice. About 73% said patients demand antibiotics for conditions like the common cold. And about 75% knew there were environmental routes for the spread of AMR genes. On the face of it, this might look like a healthy statistic. However, this tells you that conversely, a large amount of clinicians didn't know that there were environmental routes for the spread of AMR genes. Gender and work experience had no statistical association with whether or not clinicians thought AMR was a problem in their daily practice, with whether they thought ABR, antibacterial resistant infections, would further complicate medical procedures, or whether or not they were aware of environmental routes for the spread of antimicrobial resistant genes. As far as pharmacists went, about 82% dispensed antimicrobials upon having obtained complete clinical information from their patients. However, about 50% dispensed antimicrobials without a prescription. About 13% sometimes dispensed antibiotics for extended durations on the patient's request. And about 32% sometimes dispensed antibiotics for extended periods based on their personal experience. Work experience nor gender had any association with whether they dispensed the drugs for longer durations based on their personal experience or based on the patient's request, and so males and females were equally likely to partake in this particular practice. As far as the community was also concerned, about 63% of individuals agreed that AMR is a global problem. 53% believed that antibiotics cure the common cold. About 32% admitted to insisting on antibiotic prescriptions, and close to 50% disposed of antibiotics alongside their household waste. Neither level of education nor whether or not the individual was settled in a rural or urban setting had any association whatsoever with their insistence on an antibiotic prescription, and whether or not they disposed of antibiotics alongside their household waste. This was possibly the first comprehensive study which was conducted concurrently on the knowledge of all three groups at once. In this study, there were some increasingly alarming statistics that were recorded, and similar studies conducted in Asia have found responses that were equally disconcerting. For example, although majority of clinicians stated that AMR was a problem, several of them admitted to writing antibiotics for patients on the patient's request. So this immediately eliminates any aspect of culture and sensitivity in their decision-making process. Aside this, about a quarter of clinicians had no idea that AMR genes could even be spread by environmental routes. Majority of pharmacists were involved in dispensing antibiotics without prescriptions and based on their personal judgments. So what this essentially tells us is that the problem does not lie with one group. It's an array of errors occurring all over the place, and it's basically a snowballing effect which is occurring. And the end effect of all this is that AMR is increasingly becoming more and more of a problem day by day. Some members of the public gave answers that would be counterintuitive had their knowledge been up to par. For example, a lot of them believed that AMR was a problem globally, but at the same time they felt that they needed an antibiotic prescription to treat the common cold. So this basically tells us that there is a lapse in general knowledge concerning microbes, disease, antibiotics, and the manner in which they are supposed to be administered and consumed. So the general responses demonstrated unequivocally that AMR is an issue that must be addressed at a foundational level across the nation. In conclusion, the responses from all three groups indicated major lapses in the prescribing and dispensation habits of clinicians and pharmacists, respectively. The public knowledge on antibiotic usage per this study, unfortunately, was deemed to be generally low. Based on the findings, the following recommendations were made. Antibiotics should be dispensed on a strict prescription basis. Expired and leftover antibiotics should be disposed of in a Ziploc or sealable plastic bag. And there is a deep need for effective communication forums for health professionals to allow them to streamline the process of testing, diagnosing, and treating infectious diseases appropriately. The area of AMR is incredibly vast and broad, and multiple recommendations could have been made for each group. There is great hope as far as our battle against AMR goes. With the advent of machine learning, the application of machine learning, deep learning, and bioinformatic tools, it's becoming increasingly common for us to, it's becoming increasingly easier for us to isolate possible drug candidates that may go on to be antibiotics. It's also machine learning and deep learning is also helping us to somehow surveil the issue of antimicrobial resistance. Had we completely eliminated all human lapses, microbes are still going to be cunning enough to adapt, probably not with the same proactiveness that they do because of our downfalls, but they would nonetheless. Therefore, the key recommendation of this study is that the education of all individuals, regardless of their profession, inside and outside of healthcare, be paramount. The battle against AMR is an uphill battle. It always has been, and it will continue to be for the foreseeable future. The least we can do as a society and as a group is to make the hill a little less steep. These are the references that were used in the preparation of my initial write-up and in the compilation of this presentation. Thank you very much for your attention.